Major reforms of the NHS in England take effect this week in a move that critics claim will lead to privatisation by the back door. The reorganisation sees GP-led groups take control of local budgets, while a new board supervises the day-to-day running of services. These changes will only affect England, as each nation in the UK is responsible for running its own health service, and each faces its own set of challenges. This morning we're looking at these issues across the country. In a moment we'll hear from our correspondents in Scotland and Wales. But first, this report from our Northern Ireland health correspondent, Louise Connolly.
Here in Northern Ireland, one of the main differences is that the health and social care systems are combined. The government is intending to use this to their advantage, especially when it comes to caring for older people.
The country has an ageing population, with the number of people over the age of 75 expected to increase by 40% within the next 7 years. That could mean an extra 110,000 people requiring care. With this looming, the Minister has announced that the number of statutory residential homes here are to be halved, with greater emphasis instead on home care packages and care in the community. Individual budgets are to be introduced to allow people to choose the care they want.
To make all this happen, the private, voluntary and statutory sectors will have to work together. It's an entirely new landscape for the local health industry, a plan, according to critics, that looks good on paper, but in practice will be a massive challenge.
Louise Connolly there, describing the new plans in place in Northern Ireland. Well, changing the NHS in Scotland is not a top priority in Holyrood at the moment. Politicians there are focused on a different kind of reform altogether, as our health correspondent Eleanor Bradford explains.
Everything in Scotland is now overshadowed by one thing, the independence referendum. It may be more than a year away, but the Scottish Government wants everything on an even keel so nothing gets in the way of that debate. So any idea of reform, particularly controversial reforms of the kind in England, are firmly off the agenda. The only problem is that things haven't been on an even keel. Tougher targets and tighter budgets are starting to bite. And there have been unwelcome headlines of hospitals fiddling waiting time targets and patients lying on trolleys waiting for treatment. So is this evidence of a health service being left behind? Well, the Scottish Government would say the NHS is in robust health, pointing to a patient safety programme and construction projects like this one of the largest hospital construction sites in Europe.
Eleanor Bradford there. Well, whilst health is not topping the agenda for discussion in Scotland, at the Welsh Assembly it's a far more pressing matter. In the last of our reports, our correspondent Owen Clark explains the challenges facing the NHS in Wales.
Here at the Welsh Assembly, they seem to spend more time talking about health than anything else. The Welsh Health Minister sits here in this very seat, and even though he was only recently appointed in a reshuffle, he has plenty on his plate. Over 40% of the total Welsh budget is spent by Mark Drakeford's department, but the NHS here is struggling to cut more costs than it's ever done before. The government here also wants to introduce a new law that would make Wales the only country in the UK with an opt-out rather than opt-in system of organ donation. But the most pressing challenge, perhaps, is delivering some of the biggest and most controversial changes in the history of the Welsh NHS. But unlike England, change here isn't about choice or competition. It's about delivery, closing some community hospitals and centralising specialist services in fewer large hospitals. But that's led to some angry exchanges right here.